Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. Through a recent notice, Medical Counselling Committee has released the data of NEET PG candidates who have joined their seats in their respective states after appearing for the state counselling sessions. Along with this, the MCC has released the list of candidates who are joined through state counselling and have also participated in the mop-up round of All India Counselling being conducted by the MCC of DGHS, and for such candidates, the MCC has warned of removal from the said data if they fail to resign their joint seat. Maharashtra has reported 503 cases of measles so far this year and 8 deaths suspected to be caused by the viral infection. All in Mumbai, the health department said on Thursday as Chief Minister Eknath Shinde reviewed the situation and asked officials to give special attention to hospitalized patients. The Brihan Mumbai Municipal Corporation in a separate bulletin said the metropolis has reported 8 suspected deaths due to the disease and 169 confirmed cases so far. Doctors at the Asian Institute of Nephrology and Urology have successfully removed a football-sized kidney tumor weighing 10 kgs to save the life of a middle-aged man. This successful surgery is the first ever such feat registered in the Telugu states and second instance in the country. A team of urologists led by Dr. Mallikarjuna C and his team successfully performed this challenging procedure. A 53-year-old male was referred to AINU with abdominal swelling. On examination, doctors found the presence of a large abdominal mass lesion. Imaging revealed that tumor was arising from left kidney. The mass was so large that it occupied 2/3 of the abdominal cavity and it even displaced intestines into right lower quadrant. Natural substances found in the opium poppy plant. Opioids work in the brain to produce a variety of effects, including pain relief. Opioid drugs include prescription pain medicine and illegal drugs. Some people use opioids because of the euphoria they can produce. Opioid drugs can cause addiction, also known as opioid use disorder. A research team led by the University of Houston has developed a vaccine targeting the dangerous synthetic opioid fentanyl that could block its ability to enter the brain, thus eliminating the drug's high. The breakthrough discovery could have major implications for the nation's opioid epidemic by becoming a relapse prevention agent for people trying to quit using opioids. While research reveals opioid use disorder is treatable, an estimated 80% of those dependent on the drugs suffer a relapse. The findings published in the journal Pharmaceutics could not be timelier or more in demand. Over 150 people die every day from overdoses of synthetic opioids, including fentanyl, which is 50 times stronger than heroin and 100 times stronger than morphine.
We all are aware of the fact that lifestyle factors, including diet, alcohol intake, exercise, and even body weight for that matter, are all known to be associated with the onset of both cancer as well as cardiometabolic diseases. High blood sugar levels that are involved in diabetes have been shown to increase the cell signaling by the vascular endothelial growth factor, which can actually lead to more advanced cancers and also decreased survival. So a study of close to 12,000 people conducted in 6 European countries has shown that people with type 2 diabetes who actually develop cancer are more likely to be diagnosed with advanced disease if the condition is one that is not screened for routinely. The study was presented at the 13th European Breast Cancer Conference. Out of 7,400 cases of non-screened cancers, the researchers found that people who had a pre-existing type 2 diabetes condition had a statistically significant 26% increased risk of being diagnosed when their cancer had metastasized compared to people who did not have any pre-existing cardiometabolic condition. 26 cases were even detected before the cancer had started to spread, and 41 cases were detected after it had metastasized. Cannabis nowadays is widely used for recreational and medicinal drugs. Now, new research from the Institute of Psychiatry, Psychology and Neuroscience at King's College London has found no evidence that cannabidiol reduces the negative effects of cannabis. The research published in the Neuropsychopharmacology challenges the commonly held belief that using cannabis that contains higher levels of cannabidiol protects the users from psychotic experiences and memory problems, and it also suggests that this should be considered by the policymakers currently exploring the topic of medicinal and recreational use. Hematuria, we all know, is characterized by the presence of blood in the urine. This has been reported to be associated with an increased risk of chronic kidney disease. However, the relationship between hematuria that persists over a period of time and kidney function is not actually clear. This present study, recently published in the American Journal of Kidney Disease, reveals the importance of monitoring hematuria. So, in a large study consisting of relatively young and healthy Korean adults, the researchers investigated the association between the episodes of microscopic hematuria as well as the development of chronic kidney disease. They found that microscopic hematuria, especially when persistent, was associated with worse kidney function. These associations were stronger in men compared with women, but were readily apparent in both the sex groups. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.